Fat is an essential nutrient that provides both a source of energy and a variety of vitamins needed for good health. In this module, we discuss fat and look at healthy sources available for your daily fat requirements.
As a duodenal switch patient, you need to consume more fat than you did before surgery. You need fat especially to help you with your fat-soluble vitamins A, D, E, and K. If you do not consume enough fat, you will become deficient in these vitamins. Your fat requirements after the duodenal switch surgery are about 80 to 120 grams per day. Now, before surgery, you were probably getting 35 grams of fat in a day. You require this much fat because the first two pieces of your small intestine that have been bypassed is what helps your body to absorb the fat you intake. So even though you're ingesting 120 grams of fat, your body is only absorbing about 16 to 24 grams of fat. It's important that everything you eat is either dipped in a high-fat sauce or melted butter.
Fats are divided into a couple of different categories. The first one we'll talk about is your monounsaturated fats, which are actually your good fats. They're heart healthy. Some sources would include your fatty fish like tuna or salmon, also olives, avocado, your olive oil, canola oils, and so those are the fats that we want you to focus on. Polyunsaturated fats are the other category of fats, so these should be your second choice. They're still heart healthy, and these include things such as sunflower, corn oils, and also some fish varieties you'll find your polyunsaturated fats.
You need to consume saturated fats after you've had the duodenal switch surgery. Saturated fats come from animals, meat products, and animal byproducts such as whole milk, 2% milk, butter, and full-fat cheese. It's important that you realize that if you consume lean meats, you'll only get about 24 grams of fat for every 8 ounces of lean meat that you eat. However, if you eat high-fat meat sources, you will obtain about 64 to 80 grams of fat based on eating 8 ounces of meat. So we encourage you, eat bacon, eat pepperoni, eat high-fat cheeses, eat meats that are higher in fat and dip them in fat sources, and you should obtain that 100 to 120 grams of fat easily.
Trans fats you want to limit in your diet, and these have shown to increase the risk of cancer and inflammation in your blood vessels. Your sources include your fried foods, your baked goods, and a lot of your baked goods will have it because they use it as a preservative to let the product sit on a shelf for a longer period of time.
The one fat that we ask you to avoid after the duodenal switch surgery is trans fat. Many food labels will not mention the word trans fat, but if you look at the ingredient label, it will say the word hydrogenated oil. That is a trans fat, and you need to avoid that after this surgery as it will cause gas distension and diarrhea.
Let's take a moment to review this module. Because you only absorb 20% of the fat that you eat after duodenal switch surgery, you may need between 100 and 120 grams of fat daily to prevent a deficiency. When you are ready to continue, use the menu on the left to select the next module.